Imagine losing your ability to read, recognize faces, or navigate your own home due to fading central vision. Then, suddenly, a tiny device thinner than a human hair brings back a glimmer of hope. This isn't just a distant dream, it's a reality unfolding in Europe for seniors grappling with age-related macular degeneration, AMD. In this article, we'll dive into the groundbreaking news of a subretinal electronic implant that helped 80% of trial participants regain meaningful vision after advanced dry AMD. But here's the part most people miss: it's not about perfect eyesight, it's about reclaiming everyday independence through tech, training, and a bit of patient grit. Let's explore how this innovative system is changing lives, while addressing the controversies that make it a hot topic for debate. A team of international researchers has unveiled promising early results from implanting a delicate, light-sensitive chip in the eyes of individuals suffering from severe central vision loss caused by dry AMD. Published in the prestigious New England Journal of Medicine, this study opens up a potential pathway for those who've exhausted conventional treatments. Dry AMD, as you might recall, is the most prevalent form of macular degeneration, affecting millions worldwide. For beginners, think of the macula as the retina's central hub responsible for crisp, detailed vision, much like the sharp focus you use to read a book or spot a friend's smile. Unlike wet AMD, which involves leaky blood vessels, dry AMD slowly wears away the light-detecting cells in this area, leaving patients with blurred central sight, even if peripheral vision lingers. The trial involved 38 participants, averaging 79 years old, recruited from 17 medical centers across 5 European nations. Surgeons carefully positioned the ultra-thin implant beneath the retina of one eye. Fast forward 1 year, and 80% of these individuals experienced what doctors deem a clinically meaningful boost in vision, enough to make a real difference in daily life. This wasn't instant magic. Participants underwent extensive rehabilitation, learning to decode electrical signals from the implant and blend them with any remaining natural sight. As a result, several could once again read using large text and optimal lighting, or identify shapes and objects more reliably. At its core, this bionic vision setup combines cutting-edge hardware and software to mimic natural sight processes. Picture this: a camera built into augmented reality glasses snaps images of your surroundings. A small computer worn on your waist transforms those visuals into infrared light patterns. The glasses then beam these patterns directly onto the implant, which is nestled under the retina and measures about half the width of a human hair. Onboard electronics in the implant convert the infrared light into electrical pulses, stimulating the surviving retinal cells. These signals travel through the optic nerve to the brain, just as standard vision does. Users often describe it as seeing in black and white monochrome, like an old-fashioned high-contrast photo. But engineers are already working on software enhancements to introduce more shades of gray, paving the way for better face recognition, a key factor for maintaining social ties and personal autonomy. For those new to this, imagine it like upgrading an old TV with a digital tuner. The implant tunes into signals your damaged retina couldn't process before, helping your brain rebuild visual understanding. Of course, results varied among participants. Many could spot doorways, icons on screens, or large print words. Some felt more confident exploring new rooms, while others noticed sharper object placement or heightened sensitivity to light. Importantly, this system doesn't deliver full-color vision or ultrafine details, limitations tied to the implant's current pixel resolution and the condition of the patient's remaining retinal tissue. The goal isn't to achieve 20/20th eyesight, it's to surpass the threshold of legal blindness and restore basic tasks like reading or shopping. To put this in perspective, consider someone who used to struggle to see their own hand in front of their face. Now, with the implant, they might distinguish a fork from a knife at dinner, making meals less of a chore. Looking ahead, researchers are experimenting with upgrades to increase resolution, optimize power usage, and fine-tune image processing for tasks like recognizing faces or text. Animal studies hint at potential leaps in pixel density and efficiency, suggesting adaptive features that adjust contrast for low-vision users. But here's where it gets controversial: is this truly a game-changer, or just an expensive workaround that doesn't address the root cause of AMD? Critics point out that the trial lacked a randomized placebo group with fake surgery, and the intensive training participants received could have inflated results. Independent experts argue for larger, controlled studies to confirm its value before widespread adoption. And this is the part most people miss. While the tech sounds revolutionary, safety is paramount. Subretinal surgeries carry risks like infections, inflammation, retinal detachment, or implant malfunctions. Skilled vitreoretinal surgeons can reduce these, but thorough screening and ongoing monitoring are essential. Add to that the hefty costs: surgery, custom glasses, a portable processor, and months of rehab could strain healthcare budgets. Will insurers cover it for those with profound vision loss? And from an equity angle, how accessible will it be globally, especially in regions with limited resources? Thought-provoking, right? Could this implant widen the gap between those who can afford cutting-edge care and those who can't? So, why should this matter to you? AMD's risk climbs with age, often impacting entire families. Staying informed empowers you to track changes in your vision and plan ahead. Here's a quick snapshot of the key stats. Around 200 million people globally live with AMD, with prevalence jumping from about 2% among those aged 40 to 44 to 42% in their late 80s and 60% in their late 90s. The trial featured 38 participants across 5 countries, 17 surgical sites, averaging 79 years old, with 80% showing improvement after 1 year. When these devices eventually hit clinics, ideal candidates might be those with advanced dry AMD in one or both eyes, retaining enough healthy retinal cells to transmit signals. Motivation is huge, as rehab demands time and effort. Think daily exercises to retrain the brain. Factors like cognitive sharpness, hand-eye coordination, and ability to attend follow-ups also play a role. For example, someone with mild memory issues might need extra support from family or therapists to master the new visual cues. In the landscape of AMD treatment today, options vary by type. Wet AMD, driven by irregular blood vessels, often benefits from anti-VEGF injections that curb damage through regular eye shots. Dry AMD, however, has no proven cure, relying on lifestyle tweaks, REDS2 supplements, rich in nutrients like vitamins C and E, zinc, and antioxidants, and low vision aids like magnifiers. The implant fills a crucial void for advanced dry cases with viable retinal cells, offering a prosthetic boost rather than a biological fix. To illustrate, while REDS2 might help slow dry AMD's progression, like a shield against further decline, the implant acts like a bridge, reconnecting the brain to visual input when cells are too damaged for natural repair. A simple table sums this up. AMD type main issue typical care where the implant may fit. Dry AMD loss of photoreceptors in the macular monitoring, REDS2 supplements, low vision rehabilitation potential option for advanced central loss with remaining retinal cells. Wet AMD leaky, abnormal vessels under the retina anti-VEGF injections, imaging guided follow-up not the target of this study. If you're concerned about AMD, chat with your eye doctor about these questions. Is my condition dry or wet AMD, and how far along is it? Could low vision rehab enhance my reading and movement right now? Are there local trials for implants or similar vision aids? How might tools like better lighting or magnification work alongside a future device? And what level of commitment would my family and I need for training? What's on the horizon? Bigger, more rigorous studies will offer stronger evidence. Tech advancements aim at sharper visuals, longer battery life, and AI-driven features that highlight important elements like loved ones' faces. Surgical methods and post-op care will evolve, with scaled-up training programs, perhaps including at-home apps or virtual coaching. But health systems face big questions. How durable is the implant? Can over-the-air updates improve it without surgery? Will users wear the gear daily, or just for specific activities like reading? And for those with coexisting issues like arthritis or cognitive decline, how can support systems adapt? Data privacy looms large too. The camera and processor record your environment constantly. Robust policies are needed to protect information, with easy user controls for pausing captures during private moments. Imagine the ethical dilemma: is this surveillance worth the sight it restores? In the end, this slender implant, teamed with everyday wearables and unyielding determination, has guided a cohort of elders from deep central blindness toward functional vision. Upcoming trials